amazing. This is awesome. Cool to see the full house, I don't get to see that very often. Whenever I'm giving talks at UT, they're like, yeah, just do Zoom. Not many people actually physically show up. So this is very refreshing. I'm so glad you got. So I'll just give you a little brief intro about me. I completed my med school in India. I did my master's at UT 18 years ago. And then I did my residency in University of Pittsburgh, UPMC. And I did fellowship in gastroenterology at Virginia, VCU, Virginia Commonwealth University. And I was chief fellow there, stayed on as faculty. I was the advanced endoscopist and motility specialist for 7-8 years, and then moved back to UT as a director of third space endoscopy. During this journey, due to my personal health and some ethical, initially I changed my diet for ethical reasons, but then I saw benefits with my personal health. I investigated a whole lot more in it. I got board certified in lifestyle medicine, and I started seeing amazing effects in my patients. So that became my passion. So I do kind of two extremes: talk about diet and lifestyle, and do cutting edge advanced endoscopy, third space endoscopy. How many of you guys know anything about third space endoscopy? All right, how many of you are not MS1? All right, there are a few, excellent. You are MS4s, all of you? 2, okay, MS2s and some MS4s. All right, okay, excellent. So third space endoscopy is basically not just regular endoscopy. You go down and you cut out tumors. You do, for achalasia, you do perm procedures. There's EMR. There's lots of cool stuff, very high risk, and does not involve talking about diet and lifestyle at all. And then there's the other end of diet and lifestyle. So I'm going to talk about diet and lifestyle. As much as I love doing cutting edge stuff, I love this part as much as well. So that's a little bit about me. We'll try to keep it interactive. If you have any question, ask me. You can stop right there and ask me, or we can do it at the end as well, whatever you're comfortable with. All right. Everybody can hear me clearly, and everybody, okay, perfect. So this is what I know there are posters about heart disease, there are posters about all sorts of stuff. But I'm going to focus mainly on gut microbiome and autoimmune disorder, and you will see how it is going to connect to many other things that you'll see. So we'll talk about some case studies that these are my personal patients. What is an autoimmune disease? What is gut microbiome? Interaction between gut microbiome and your immune system. Factors that cause unhealthy gut microbiome, and how do you improve your gut health? All right. So first patient, this was a 39-year-old female with Crohn's disease. How many of you know Crohn's disease? All right, good. Everybody knows it. So Crohn's disease, she was suffering with it for a long period of time. And she was on immunomodulators. She had one surgery, but she was not improving. She continued to get worse. And they were going to start her on biologic agents, of course, big gun. And you require IV infusions every month, all of that stuff. Before that, somehow she got my contact and she reached out to me. I was like, if you're willing to do diet and lifestyle modification, I'm happy to help you. Otherwise, there are plenty of doctors who will be happy to prescribe you medication and be done with it. She's like, I'm willing to do anything. This life, and my life is miserable. I've tried everything, nothing's working. So I talk with her. She listens to me, very important. She follows through all the recommendations. We are in touch regularly. And 3 months later, she is symptom-free, disease-free, and medicine-free. Another patient with 45-year-old hand colitis, ulcerative colitis, the entire colon was involved. It was quiescent with diet and 5-ASA. So 5-ASA is mesalamine, that medicine that you give. It's a topical medicine you swallow, and it just helps seal the colon. Now, whenever he goes on poor diet, whenever his mom visits him, his mom's like, oh, you're not eating anything. You need to eat everything. And she will push food in him, all kinds of foods. And then, of course, his disease relapses, and then he comes back to see the doc. This is the problem. 53-year-old female with ileocolitis for 6 years. She's a teacher. She's a principal at a school. Well controlled purely on diet and lifestyle. And there are many, many more, and not just ulcerative colitis or Crohn's disease, because traditionally we are taught these are Once you get the diagnosis, you're done for life. Rest of your life, you're going to have it. You're going to take these medications, which can potentially cause cancer, which will suppress your immunity. And you'll have to be taking them every month. You will lose the response to it. It's a long, pretty hard life, but you can change the course. Now, I'm going to focus on it because everything else is easy. This is kind of difficult disease. So if you can manage difficult disease, the rest of the diseases are pretty easy. All right. So what is autoimmune disease? First of all, what is normal immune response? When an invader like a virus enters your body, immune cells called lymphocytes create antibodies to fight the invader. Simple as that, right? Autoimmune disease, what happens? Your immune system creates antibodies that attack your own cells, right? So your own soldiers fighting your own cells. A foreign substance resembles bodily substance. Normal body cells become altered. Lymphocytes malfunction and make abnormal antibodies. So your antibodies see your own protein, your own antigen as foreign and starts attacking. And that's nothing but autoimmune disorder. All right. So what are the diseases of autoimmune etiology? Pretty much top to bottom, everything can happen, right? So if you just go in from left in clockwise fashion, allergies. Majority of us suffer through allergies. I personally suffered for decades of my life. Asthma, be it in kids or adults, SLE, multiple sclerosis, rheumatoid arthritis, psoriasis, Graves' disease, diabetes, Raynaud's, Addison's, scleroderma, celiac disease, so on and so forth. Plenty of other diseases, right? So let's focus a little bit about Hashimoto's thyroiditis, IBD, that is Crohn's and ulcerative, type 1 diabetes, rheumatoid arthritis, celiac disease. I'll give you some examples of these, how you can correlate with your gut health with these diseases. All right. So a question for everybody. Where is the root cause of more than 80% of your illness and health in your body? Brain? Heart? Nobody? Lungs? Gut? All right, some of you think, no bias there, right? So, of course, gut. So what is gut microbiome? How many of you know what is gut microbiome? All right. Yeah, some of you have heard of it, some of you know it. What is the difference between, bonus points, what is the difference between gut microbiome and gut microbiota? No? All right. You have? You know? So, gut microbiome is the genetic material and microbiota is actual microorganisms. So you will always hear gut microbiome used interchangeably, but they're really talking about genetic material that comes out of this bacteria, and you'll see how it's important. So these are microorganisms in your colon, right? More than 100 trillion. Now, the number varies. Some say 40 trillion, some say 100 trillion, some say more than that. But there are plenty of bugs in your colon. More than 3,000 different species. Plenty of them. We don't even know yet. And the beauty of it is, just like your fingerprints, everybody has a unique gut microbiome print. All of you. There are mainly two broad categories. If you want to just divide into two, the two would be Prevotella species and Bacteroides species. The Bacteroides are the bad ones, and Prevotella are the good ones. The microbiota is the actual. Their microbiota, the genes of microbiota are more than 150 times the human genes. So when you say, oh, it runs in my family, it's the genes, it's not your DNA. Your DNA is just 1% of who you are. More than 99% is the microbiota gene, which you have complete control over. The genes that you're born with, you have no control over. You just got them. But 99% that runs your body, you have complete control over. Remember this part next time when you're talking to your patients or you're thinking about your diseases or your family members. So more than 90% genes, and I gave a conservative estimate, but majority will say 99% in our body are from these bacteria, viruses, parasites, so on and so forth. All right. Interaction between gut microbiome and gut wall. So far, everybody's with me. Any questions? Feel free to ask anytime, okay? All right. Healthy gut microbiome equal to healthy gut. Simple as that. Unless and until we drill this down in our brain, we're going to get confused all this time. All right. So microbiome genes, every gene produces different chemicals, right? We know how it reverse transcription and all that stuff happens. Just for example, your body produces about 16 or 17 enzymes to digest carbohydrates. Guess how many enzymes is microbiome produced to digest carbohydrates or different compounds in your food? Any guesses? 17 from your own genes. How many from these bacteria? Any guesses? Wild guess. Go. 200? 1700? 60,000. No comparison whatsoever. 60,000. As I said, your body is run by these bacteria. See, the digestion, they break down complex starches, undigested carbohydrates, fiber. They don't just break it down, they make it in supercharged molecule for you. How many of you heard of short chain fatty acids? All right. The most important molecule that you want to remember is this one, short chain fatty acids. And thanks to these bacteria, we get that. Of course, good bacteria, not the bad ones. And this is what your colonic cells live on. This is what makes sure the integrity of your colonic wall is maintained and your immune system stays strong. And not just that, I'll tell you benefits after benefits of that. There are three major short chain fatty acids. The first one is butyric acid, source for colonic cells, nutrition, energy. How many of you have experienced brain fog? All right. This is your recipe to get rid of it. So butyric acid connects with your brain so well, and all the inflammation that you have at the blood-brain barrier, this will get rid of it. If you don't have this, you're inviting inflammation. Simple as that. Your colonic cells live on that, by the way. If you don't have, your colonic cells don't have this butyric acid, they're not going to get their nutrition, they're going to get damaged, you're inviting ulcerative colitis, inflammation, cancer, so on and so forth. Polyps. I remove polyps all day long, every day. 30 to 40% of us have polyps, at least that we know of. Acetic acid produces acetic acid, right? Acetate, it's energy to muscle cells. Propionic acid, it's liver production of ATP, so it does gluconeogenesis. But the key part is GLP-1 agonist. Have you heard of GLP-1 agonist? Which is the most popular blockbuster drug right now. Ozempic. How ridiculous is that? We're paying 1,500. Patients are paying their lifetime saving away to get that drug, which you can get it for free. For free, your own gut is going to produce it. You're going to get the satiety, and guess what? No side effects. I see a ton of patients with severe GI side effects, worsen gastroparesis. I end up doing the gastric per oral endoscopic myotomy, fancy procedure, cut their sphincter, keep them in the hospital. They have complications, and so on and so forth. So many complications from this drug. There was this concern that they were even causing pancreatitis, pancreatic cancer. Of course, there was data that came out afterwards. Oh, it doesn't do that. We see it all the time. We don't know yet. All of that from this expensive drug, which we are spending thousands of dollars per month, plus you lose a lot of muscle mass, not the fat. And then guess what? When you stop taking it, weight comes right back on. Whereas you can just make sure your bacteria is all taken care of, and you get this for free. Good enough? Everybody's convinced that this is important? All right, okay. So gut microbiome chemicals, metabolism. Primary bile acids produced by liver, they're converted into secondary bile acids by the gut microbiome. Now, if you have bad microbiome, cause disease. If you have good microbiome, you're going to be healthy. So secondary bile acids are directly related to colon cancer, by the way. They're also causing gallstones. You know, what were you taught about gallstones? Who has gallstones? What was the 3 F's? Fat, unfortunately, not politically correct, but we used to say fat finger in 40s. Not anymore. Not anymore. From teenagers, I have even seen 6 and 7-year-old kids from teenagers till patients who are 80s and 80 in their 80s and 90s, males and females, everybody has gallstones. I mean, I'm doing ERCPs after ERCPs every single day for stone disease. Doesn't matter what age, what sex, none of that matters. It's insane. And all of that because bad microbiome. They synthesize vitamins for you. Whoever thought that you get vitamin B from this product or that product, it's not from any of those products. It's from the bacteria. If you don't have good bacteria, you're going to be B12 deficient. Vegetarians or non-vegetarians, vegans or non-vegans, everybody's deficient in B12 because we don't have good microbiome. If we take care of the microbiome, they're going to produce the vitamins for you that are needed. B12, K, biotin, folate, B1, B6, name it, plenty of other chemicals that we don't even know of yet. They inhibit the bad bacteria. So all the bad bacteria that will kind of ruin your immune system are inhibited by that. So it regulates our immune system. It protects against infection. So 70% of your immune system is in the GI tract, regulated by your gut microbiome. When I learned, I was shocked and surprised. It took me to complete my gastroenterology fellowship, to become an attending, start teaching, and I had no idea about nutrition even then. And later on, just because of my passion and interest, I started reading and I learned 70% of my immune system is in my gut, and so is yours. How many of you knew this fact? See? And unfortunately, we are not taught this in any of the medical schools. So you need to learn this part. You know, COVID, does it have any relation with this gut microbiome? Yeah, what's the relationship? So they found that those who are on a healthy diet, 80% of them will not have. So likelihood of you having severe COVID is less, 80% less compared to those who do not. So not just COVID, any other infection, the same rule. So you fix your gut microbiome. You don't just fix the ulcerative colitis or autoimmune, but you're protecting yourself from every other disease you can think of. So gut bacteria, genes, chemicals, all right? Good chemicals, they will help you digest food. Lean, help you weight loss. With your weight loss, improves our immunity. No infection, autoimmune diseases, cancer. Improves our response to medicines and chemotherapy. Have you heard of this chemotherapeutic agent, cyclophosphamide? It works really well if your gut microbiome is good. Actually, it uses your gut microbiome to break it down so that you can actually get treated very well. If you don't have good gut microbiome, that drug is not going to work. So chemotherapy, other medicines, they work well if you have good gut microbiome. Simple as that. What did Hippocrates say about the food? Hippocrates? I don't know if I'm, yeah? Do you know, what did he say? Let food be thy medicine, right? He mentioned that so long ago, but we don't really. It of course helps you heal our GI tract, heart, liver, brain, you name it. All right, bad chemicals, poor digestion, digestive disorders, you become obese, impaired immunity, recurrent infections, autoimmune disorders, cancer, and then we take antibiotics that further ruins our gut microbiome. Impaired response to medicines and chemotherapy, and inflammation all over your body. So you are what they eat. We've always heard that you are what you eat, but you're really what they eat. What you eat goes to the bacteria and what they consume, and that's how you get good or bad bacteria, and that's how you become who you are. So we say always water the plant you want to grow, right? Similarly, feed the bacteria that you want to grow. Interaction between gut microbiota and our immune system. Now, this is a very, very important slide. If you understand this, then this lecture was worth it for you. So everybody can see it's a little bit small letters, a little bit distant for you, but hopefully you will be able to see. And I have a second slide to make it simpler, but this I wanted you, because you're all medical students, I wanted you all to see this. So I don't have. So the top part is the lumen. The white part is the lumen of your GI tract. The green part is the mucinous layer covering your GI tract. This is the small bowels or large bowel cells, right? These are villi. And that's the behind this is epithelium, and this is a subepithelial layer. Muscularis mucosa, lamina propria, submucosa, muscularis propria, you name it, whatever. All right? So there are secretory IgAs, immunoglobulin A, or antimicrobial peptides, polymeric IgA receptors. So all your immune system is working here. Your training ground for your immune system is happening right here. There is a protective layer between your gut and these bacteria. That's the mucin. That's a protective layer. And there's a bacteria on top of that. So the top layer is bacteria, and there's mucin with all the antibodies and the peptides, antimicrobial peptides. And then there is these cells which have really tight junctions. These tight junctions make sure that the bad stuff does not enter into your wall, because now if the bad stuff enters into your wall, your body detects that as foreign antigen and starts creating antibodies against it and attacking it. Now, what happens is, let me ask you, since I'm GI, I'm going to ask, of course, GI-related question. What is peptic ulcer disease? And does anybody know? Have you learned that? What is the cause of peptic ulcer disease?
H. pylori.
Huh?
H. pylori.
H. pylori. All right. NSAIDs, how about NSAIDs? NSAIDs cause peptic ulcer disease? Why do they cause peptic ulcer disease? Huh? That's right. They destroy the mucinous layer, and now the acid has access to the wall to destroy it, to chew it up. So the NSAIDs and many other medicines will destroy your mucin layer. So now the bacteria which never had access to your gut wall now has clear access to your gut wall. When we eat all the processed foods, all the chemicals, how many of you know what is celiac disease? What's the enzyme that we create antibodies against? Tissue transglutaminase. Now, I want you to start reading ingredients for the foods you eat. You will read something called as microbial transglutaminase that comes in these processed foods. With the medicines and with all the chemicals, with the emulsifiers that emulsify the mucin layer. You know what is emulsifier, right? Emulsifiers, all your foods have, processed foods have emulsifiers. And they emulsify this mucin layer, so now all the badness have access to the wall. So with the emulsifiers, with the medicines, with all the bad preservatives, we have destroyed the mucin layer. The microbial transglutaminase, that would have never entered the GI tract, now gets through the protective layer and gets inside the gut wall. Body sees this as a foreign antigen. All right. Body starts creating antibodies. And those antibodies start circulating in your body. And what does it see? Tissue transglutaminase. Wait, there is foreign body inside my body as well. Starts attacking it, and what do you have? Celiac disease. Just one example. There are examples after examples how these diseases occur. Of course, this is one of the theories that has not become very popular because nobody wants to talk about it. 30% of the population has the disease, the genes DLQ2 and 8. So 30% of the population has those genes, but only 1% of the population will end up with the celiac disease. And there's a theory right there how that happens. So your protective mucin layer gets destroyed. The bad food will make sure bad bacteria grow. They have access to the gut wall. Now the gut wall is destroyed. The tight junctions are no more tight. You end up with leaky gut. All the badness gets in. And now we have antibodies against stuff. And now you end up with autoimmune diseases. And whatever autoimmune disease you want to name, everything starts from your gut. Doesn't matter if it's related to your brain, your heart, wherever. It all starts in the gut. All right. This is a simplified version for you all. Same slide. So villi, beneficial bacteria, protective mucus coating, mucus producing cells, intact villi. Now there's blood and lymphatic vessels within the villi. If we break down our mucus coating, inflammation ensues. food, bacteria, and toxins enter. And there are plenty of other toxins that I'll talk to you about that get access to the gut wall. And now you have damaged and leaky gut, which leads to poor absorption of food, systemic inflammation, nutrient deficiencies, food intolerance, like, oh, I can't handle good food. Have you seen patients who have allergies to strawberry, blueberry? Have you ever heard that? Did you ever hear that before? We have all these things. We didn't have that decades ago. Now all of that is so common because your gut cannot handle the good stuff anymore. We have destroyed the wall. Now we have all kinds of food sensitivity. But the good news is once you learn this, once you understand it, you can start the reversal process. All right. Have you heard of Dr. Clapper, Michael Clapper? This is his slide. He's amazing. He works with lots of medical schools. So his story is amazing. He's been practicing for 50 years. Actually, now he retired and he just gives talks to medical students. But this was his slide and he calls it a red tide. So this is your gut lumen. This is the villi epithelial cells. And what are we attacking our gut wall with? So we are attacking with bacterial peptide antigens. All the meat products that you consume have a ton of bacteria. You cook them, the endotoxin still stays. If they're alive, there's bacteria. All of that are hurting your gut wall. Free radicals, lots of meats will have free radicals, hydrogen sulfide, endotoxin, oxidized protein. Just the animal protein by itself raises inflammatory bacteria. Heme iron, known carcinogen. Detergents destroy your mucin layer. Aldehydes, known carcinogen. A brief story about aldehydes. How many of you use Listerine? All right, Listerine has alcohol in it. Do you all know? Yeah? So we take a sip, we swish it and spit it out, right? 15 seconds, 30 seconds. In that time period, that alcohol is actually now, metabolic product. It's metabolized to acetaldehyde. And that 15, 20, 30 seconds of exposure makes sure that breast cancer cells grow for next 7 to 8 hours. Now just imagine a whole glass or multiple, and then you consume it all. It's in your body. So multiply that by number of hours. I see so many patients with breast cancer celebrating, oh, I beat the cancer by drinking wine or any kind of alcohol. So we just suffered through something, and now we go back and drink one of the etiology of the cancer by drinking wine. So alcohol, aldehyde, polycyclic hydrocarbons, arachidonic acid, maltodextrin, fructose, so on and so forth. So all the stuff that we consume on a constant basis has these kind of chemicals, processed foods and animal products. And now we're destroying our mucin layer, leads to macrophages activation, CD4 activation, inflammatory cytokines, chronic inflammation, and you end up with inflammatory bowel disease. That's just one of the things, but everything else that we talked about. All right. Have you heard of stool transplant? All right. How powerful that is, right? Ulcerative colitis patients receive stool transplant from healthy people. Symptoms improved or resolved. Happy patients received stool transplant, or happy patient's stool was transplanted to depressed patients. Happy patient. Of course, these are all short-lived results because you have to really fix water the plant you want to grow, feed the bacteria you want to grow. You can give the bacteria, but they will only last so long because you are not giving the food for them to thrive upon. So you need to really focus on that part. So these are short-lived results, and this was practiced thousands of years ago, by the way. In Chinese records, you can find that data. They used to give yellow soup for treatment. That was the yellow soup. All right, this was a study. Fecal microbiota transplantation with anti-inflammatory diet, followed by anti-inflammatory diet alone, is effective in inducing and maintaining remission over 1 year in mild to moderate ulcerative colitis. Now, this was a randomized control trial, right? Holy grail for us doctors. Case control of association, no value. We want randomized control trial. This was randomized control. Published in Gut, very powerful journal, big impact factor, European journal. So what they did was patients either got the standard medical therapy or they got stool transplant and anti-inflammatory diet and make sure that they continued on anti-inflammatory diet for a year. They compared the results. So look at the bars. Clinical response, 2/3 versus 1/3. Odds ratio 3.5. Steroid-free clinical response, remission at 48 weeks. So 1 year, you didn't need any steroids. You were in remission just by diet and fecal medical transplant in the beginning versus the standard medical therapy. 50% was 32.3, odds ratio 2.1. Deep remission. Now that's what we're looking for. As doctors, what are we looking for? Deep remission, that mucosal healing. A third of patients over here versus just less than 10% in standard medical therapy. And, at 48 weeks, a quarter versus 0%. So if you have standard medical therapy, 0% deep remission at 1 year versus with diet and lifestyle. So powerful. These medications, ulcerative colitis medications, if you know somebody who's suffering from them, ask them. Such a pain. They have to get their infusions all the time. They have to monitor it. Antibodies, then they fail, then you have to go and find something else, and your insurance gives up. Insurance does not cover it. So they go through so much pain, and you have to check on it all the time. You're worried about infection because the immune system is suppressed. So on and so forth all the time. These are so expensive. And plus, we doctors make a lot of money in this process because we keep scoping them, we give them infusions, we get to see clinic visits. So we are not incentivized to, help them go in remission without medical therapy. Our incentive is in doing more procedures, giving them more medications. That's the unfortunate, sad part. This was a very interesting study in Japan. Everybody who walked in with inflammatory bowel disease, everybody, they gave them the same education. Like, if you change your diet, this will help you. Everybody got the same education. Of course, everybody gets the same education. Some follow, some don't. But they kept track of these people. And at 1 year, at 2 years, what do you see? Those who actually made serious changes, they didn't go 100%, but they made semi-vegetarian diet versus those who continued their omnivorous diet. Look at the response, the remission at 2 years, 700 days, almost 2 years, almost more than 90% compared to those who did not follow through. Of course, the numbers were small. The numbers weren't huge. But that generates hypothesis, and we just saw randomized clinical trial. Molecular mimicry. We talked about tissue transglutaminase. So celiac disease example, antibodies against own enzyme. So DQ2 and DQ8, 30%, but this is only 1% of population. So microbial transglutaminase, common in meat products and baked goods. And many times you will be fooled. They will label it differently. So you will have to Google it. You don't even know you're consuming microbial transglutaminase because they'll change the name. And these are legally allowed. So there's something called as GRAS, generally recognized as safe. About 10,000 different chemicals got approved under this vague terminology. And now they're all over in your diet. Everything that you consume, every drink that you take, Sensor, Monster, I don't know, it's been going crazy. I see patients with severe diseases because of all these chemicals and all the soda that we consume, phosphoric acid in it, you name it, everything that we consume. And I'm saying we because I used to do that a lot and I suffered. I stopped doing it now. But just going by the statistics, majority of people in this audience are doing the same thing, unless lifestyle medicine followers have given up. So common meat products and baked goods. So we are exposing diabetes type 1. How many of you thought that it was related to diet? Autoimmune disorder against insulin-producing beta cells in human pancreas, right? That's diabetes. We all know that. Beta-casein in cow's milk is similar to human beta cells. So now we destroy the mucin layer. Now we destroy the tight junctions. We destroy the epithelial cells. You have inflammation there. The protein has access. Body's producing antibodies. Of course, not a very popular theory, but a theory nonetheless. Makes sense. Arthritis, rheumatoid arthritis, psoriatic arthritis, Hashimoto's thyroiditis, same theory, same. All these animal products have similar proteins like humans do. Plant products don't have those. And guess what? The end result? Molecular mimicry and autoimmune disease. So what are the diseases that you end up with unhealthy gut microbiome? Irritable bowel syndrome.
Sorry. On the slide, I was just wondering, could you explain a little bit about how, with the prevalence of, people eating meat and drinking milk, if these are the cases why the disease prevalence is so low? Like you mentioned in celiacs, it had like 30% genetics and only 1% disease.
Yeah. So everything, if you look at all the diseases, the prevalence is increasing. In the countries that they didn't consume as much, they started consuming so much of this stuff, and the prevalence is increasing. Of course, it's not just one factor, but that's a major factor. And that's why the prevalence is increasing significantly. And there are so many patients out there who don't have the affordability to come and see you. And, or 15% or just have 15% of the population has really, really strong genetic gene setup, genetic setup, that they're able to fight off a lot of these things until really late. But if you think about this, the thing that I was taught in residency, based on the age of the patient, if they're in their 30s, they're going to have 3 diseases. If they're in their 40s, they're going to have 4 diseases, and so on and so forth. That has changed. Now you see that much earlier, and number is increasing. There are multiple factors, but we have to understand and recognize, why is this happening? Like, your protective layer is destroyed. So many things are happening, right? You're getting the medicines, you're taking the processed foods, then you have bad bacteria coming in from bad sources. You don't have any good bacteria coming in. Your vulnerability has increased. Maybe the patient actually didn't get vaginal birth, got cesarean section, so they didn't have the microbiome to begin with. Their stress levels have increased. So you put all of that together, then there is sound pollution. You put a ton of chemicals on your body. All sorts of these shampoos and lotions. If you look at the chemicals in it, insane. Then Roundup. You know what is Roundup, right? Shikimate pathway. How many of you know Shikimate pathway? This Roundup, or these pesticides that were created to make sure your yard stays safe, was designed to kill the weed, right? Kill the weed. Because humans don't have the pathway that plants have. So they came up with these revolutionary chemicals, and that killed the weed. But you end up getting that in your body through different ways. And guess what? Your microbiota has the same pathway. So we kill our good microbiota using the same insecticides to destroy. So there are a million different factors. That's the red tide that I was talking to you about. There are many more that I cannot talk about because of the time constraint. But where does it all begin? Whatever you put in your mouth. You are truly what you eat. Whatever you consume are the building blocks of your body. And we are destroying it at multiple different levels. That's why they were like, oh, but you can't. What are we designed to do? Change one thing and see what the result is. Let's give one medicine and see what the result is. We never think about 10 different factors acting together. And if we stop 10 different factors, the results that we're going to get is phenomenal. Does that answer your question? All right. So what are the diseases due to unhealthy gut microbiome? Irritable bowel syndrome. Like, majority of the patients in my clinic will have this. This is a black box garbage term. I don't like it at all. It's not irritable bowel syndrome. It's just that we haven't gotten a detailed history. We haven't really asked the right questions. I mean, if I take a patient's history, I ask them 20 different questions, and they go, Doc, nobody ever asked me these kind of questions. How do you sleep at night? What time do you stop eating? How much do you go out in sunlight? There are plenty of other questions that when you put them together, sunlight has gotten bad rep. Everybody's like, put your sunscreen on. Nobody's getting the sunlight, and everybody's vitamin D deficient. And it's just one vitamin D factor that we know, but there are plenty other factors that are independent of vitamin D that are present in sunlight that's going to help you. But we have gotten away from that. Inflammatory bowel disease, of course, ulcerative colitis, immune disorders. We talked about that. Infections, small intestinal bacterial overgrowth. So many patients that come, oh, I have SIBO, there is a new test out there, I'm going to take that. And how do you treat it? By taking antibiotics. So you kill the good bacteria furthermore. Oh, I feel great until I don't, and symptoms have gotten worse. Cancers, such high prevalence of cancers. GERD, Just by statistics, 30 to 40% of you have experienced GERD. And just because you're in medical world, probably the number is double. 60 to 70% of you have suffered from GERD. And then we consume what? Soda and coffee to make sure we stay awake all night. And what does that do? Destroys your lower esophageal sphincter, destroys your gut, and you're worsening the symptoms furthermore. Constipation, diarrhea. I'm not even going to begin. How bad this is. Everybody's suffering from either of those two or both. And that's one way to make sure that we destroy our gut, destroy our health. Heart disorders. Every single thing begins in your gut. All the chemicals begin in your gut. There is heart-gut axis. There is brain-gut axis. There is liver-gut axis. Every single thing is related to your gut. Diabetes. I mean, I've reversed diabetes in 6 weeks. Of course, it was type 2 diabetes. Easily you can reverse it. If they've had it chronically for a long period of time, for decades and decades, it's going to take longer, of course, because we have destroyed our body so bad, it's going to take longer to heal. But the fact that you can reverse it, I never heard that. I was like, oh, if you have diabetes, you have to take medicine for the rest of your life. And data shows that once you get one medicine, a few years down the line, you'll be on 2, then 3, then 4, then insulin on top of these medications. It's not because you're not producing enough insulin. Oh, you're insulin resistance. We can't do much. You can do a lot. You can reverse these diseases. And this is a side effect, by the way. My goal is to treat the GI illnesses. As a side effect, they come and tell me, oh, my hypertension resolved. My hyperlipidemia went away. I don't need to take any more medications. My diabetes resolved. Glaucoma. Do you know what is glaucoma, right? Oh, my pressure used to be run in 20s. I used to take drops every day. My vision is great now. Pressure is 7. At the age of 75, after destroying their gut for 75 years, within 3 months, they were able to make such amazing, recovery. Patients after patients, every single day, I get to hear these stories. Liver diseases, of course. Skin diseases, all kinds of skin diseases. Mental illness, depression, anxiety, completely under your control. Of course, there are other factors. Even if you can't, let's say, oh, but I have had, or the patients have had such amazing, not amazing, but bad experiences, and that's why they're suffering. But when you change your diet, you have the capacity to tackle these things. You decrease the onslaught on your brain with the inflammation, with lack of butyric acid, with plenty of GABA to help your brain. So you can actually help yourself. Have you heard of psychbiotics? Anybody has heard of psychbiotics? Psychbiotics, these are chemicals that actually are created by these microorganisms create these enzymes that help you actually with your mental health and many other diseases. I mean, generally we say 70 to 80% disease, but I think more than 95% of disease are related to your gut health. Yours, and actually data shows that if your grandma was not eating healthy, even that impacts you. So the diversity in your grandma's microbiome was lower. Then your mom continued that diet, that got lower, and you continued your diet, and the diversity even got much, much lower. So up to 3 generations, you can see the effects. The data clearly shows that. But you have the power to change that. It's not all doom and gloom and doom. No, you can actually change all of that. Factors that cause unhealthy gut microbiome. So if you haven't, got the answer so far, I'll keep doing that. All right, what is the most common nutrient deficiency in Western world? So protein deficiency, how many of you think protein, we need more protein? How many of you think we need more protein? There's such a huge industry out there to make sure you take more and more protein. By the way, Dr. T. Colin Campbell clearly showed that more protein consumption is directly related to cancer growth. If your diet consists of more than 20% calories of protein, especially animal protein, cancer cells grow really, really fast. Vitamin B12 deficiency, pretty common, but not the most common. Vitamin D deficiency, again, very common, but not the most common. Fiber deficiency, who said that? All right, okay, very good. So how many people in Western world, or let's stick to America, in America, are deficient in their fiber intake on a daily basis? How many? 90%. Good guess. Anybody else? 97%. So just by the data, going by the data, if there are 80 people here, probably only 2 of you are consuming enough fiber, but all of you are medical students. So my suspicion is that none of you are consuming enough fiber. So I've given conservative estimate, but data clearly shows that 3% or less are consuming enough fiber every day. How much should you consume fiber before I go to the next? How much fiber should you consume on a daily basis? Minimum.
24,
23, 30.
26 for females.
So yeah, so about 25, 26 for females minimum, and for males about 38. But if you truly want to be disease-free, your goal should be 70, 80, 90 grams of fiber a day. But minimum, let's try to reach the minimum first. All right. How much fiber do you think animal products have? Zero. Dairy products, milk, cream, cheese, butter, yogurt. Who likes cheese here? You know why you like it? Why you can't stop eating it?
Sugar.
It's addictive. So the protein breaks down into casomorphine and goes and triggers your narcotic center, your opioid drug center. So when you consume it, there is no satiety center there. You consume one slice and want another. You probably consume 1,000 calories and still you want to consume more. How many of you have eaten 5 apples in a row? Like 5 apples. 5 apples at once? Good for you. All right. So generally speaking, when you're eating fruits, after a couple or 3 or 4, you're going to be like, oh no, I'm full. But do you ever say that when you're consuming cheese or ice cream? Oh, I had a whole tub, or chips. It destroys your satiety center. It messes up your satiety hormones. It messes up your ghrelin. And you have no way to tell that you have consumed enough. Now it's the time to stop. And so this is what the industry does. So you can keep buying more, keep consuming more, and the result is more than 2/3 of America is obese. What's that? All right. But it's so good. All right. Eggs, no fiber. Who says eggs is not healthy, by the way? Any FDA cannot say eggs are healthy. It's illegal for them. So they came up with, so they had email exchanges with the egg industry to figure out how we can word it so that everybody will be fooled in thinking it's good for you. And at the end, they were like, yes, that sounds perfect, does not break the law, and still we achieve the goal. This is public data, by the way, very easily available. Meat. Oh, I just consume lean meat, white meat. No, no good. Chicken increases pancreatic cancer risk or associated with increased pancreatic cancer risk 9 times. Chicken is associated with pancreatic cancer, 9 times the risk. Colon cancer, 3 times the risk. So don't be under this false impression that chicken is good for you. Not. Fish, processed fish, definitely associated with cancer. Have you heard of this chemical TMAO? Trimethylamine oxide. So it is a chemical produced by, when you consume these kind of foods, your gut bacteria breaks it down. TMAO is a recipe for heart disease, cardiovascular disease. So ex-president of American College of Cardiology, Dr. Kim Williams, says that just for the fact that it causes TMO, that's reason enough to give up all these products. Just for one reason. There are a million other reasons. So sugar, oil, packaged processed foods, artificial flavors, emulsifiers, coloring agents. By the way, all these artificial flavors and coloring agents, they directly go and impact your brain, and the diagnosis is ADHD, low IQ, lack of focus, all of that because of. So it's all related to what you eat. Preservatives. Fiber deficiency also causes longer transit time through GI tract, more rotting of the bad food that we consume. So fermentation is supposed to be good, right? But not of processed foods, not of animal products. That creates inflammatory bacteria, inflammatory chemicals, causes problems. What is the normal transit time? Does anybody know? GI question. What is the normal transit time through your GI tract? 12 hours? Wow, no.
8 hours.
36? Okay. 8 hours? 8 hours. So small bowel, from small bowel, 20 feet of small bowel, the food will travel through small bowel within 6 to 8 hours. All right. Sometimes it's faster, sometimes slower. But the colon is where your food stays for much longer period of time. So in your stomach, it will probably stay there for 3 to 4 hours. Small bowel, probably 6 to 8 hours. But in colon, depends on what you're consuming. It can be either 24 to 36 hours or 72, 96 hours or even longer. So you think, oh, I didn't consume anything, but the stuff that you consumed 3 days ago is still sitting there, still rotting if you ate all the stuff that we talked about. So if you consume high fiber diet, it's going to get out of your system within 24 to 36 hours, make you feel healthy, lighter, amazing. If it's all processed food, animal products, it's going to sit in your system for 3 to 4 days. It's going to rot, release chemicals, brain fog, no clarity, dragging your feet, feel heavy, no energy. And I have another assignment to finish. I have to finish these chapters and have another class. Does that feel like somebody you know? Unhealthy gut microbiome. So antibiotics kill all the good bacteria also, not just the bad bacteria. They literally wipe it off. Toxins, environmental chemicals, tobacco, alcohol, marijuana, pretty bad. I've seen a ton of patients because it's legal. People think it's healthy. It's not. It's ruining their life. I do all kinds of complex procedures. I'm like, it's no use unless you stop consuming it. Poor sleep pattern, hygiene. At night, YouTube Shorts, Instagram, TikTok, whatever that might be, destroys your melatonin. Within matter of minutes, your brain thinks, am I good on time? You're okay? Yeah? So within minutes, your brain thinks that it's daytime, gets rid of melatonin and all the beneficial effects of melatonin. Melatonin will actually make sure that it heals your body at night. It does the power of sleep is the biggest healing factory that you have. It power washes your brain as long as you do it right. It power washes your brain. It deletes all the bad memories, consolidates good memories. All whatever you memorize stays with you if you do it right. But if you don't get sunlight exposure, our brain does not know when it's the daytime and nighttime. We're always in the light, so brain does not know when to start releasing melatonin. Plus, we're watching the screen. Oh no, but I use blue light filter. Doesn't cut it. Doesn't cut it. Even your bacteria in your gut, they also help you produce melatonin. And that will make sure your LES gets tighter, your acid reflux will actually go down if you sleep better. So go out in sunlight, make sure you are in the sunlight, your body knows that you're in sunlight without the sunscreen, and then make sure you don't get any screen exposure at least for an hour before you go to bed. Lack of exercise. You guys are busy, but try to incorporate that in your life. Stress. That's plenty, right? Medical field, this is just the beginning. There's going to be more and more of stress coming your way. Cesareans, I just mentioned that earlier. If the baby is born, not with vaginal delivery, but cesarean section, then they don't get the vaginal microbiome exposure, and that does not inoculate the microbiome into their gut. Formula milk, same problem. Of course, some of the things are not under your control, but a lot of these things are. Increases your inflammation, risk to catch more than 80% of all the disease. So how do you improve your gut health? Eat fiber. All right. Foods rich in fiber. All right. Whole foods, plant-based diet. So fruit juice is okay, right? No. Whole fruits. That's right. You guys are right. Don't consume fruit juice. Not good at all. Actually, the whole fruit. So fruits, grains, whole grains, not processed grains, legumes, vegetables, all kinds of seeds and nuts. Microbiome thrives on fiber. All right. The goal should be more than 40 grams, ideally 80 to 100. Whole foods, no need for any supplements. Now, of course, if you're not going to go out in the nature to get the natural microbiome inoculated in your body, then you need to supplement your vitamin D and vitamin B12. Right now, what's happening is all the soil around you is also has ton of insecticides and pesticides. All the chemicals are killing all the bacteria. So you don't get those bacteria, and you end up with vitamin B12 deficiency. And you think, if I consume meat, I won't be deficient. But you know what? The cattle is getting B12 supplements, and that's how you think they have their B12 supplement. They're producing B12. They're not. They used to back in the day, but now they're also, because they don't get to go out and they give B12 supplements to the animals, and through your milk and meat, now you get B12 because you're consuming the middleman to consume what? B12 supplements. Might as well take B12 directly. These are the things you should consume or not. All right? No. No animal products and no processed foods. No chemicals. Start reading your ingredients. No chemicals, preservatives, emulsifiers, coloring agents. So anything that grows on the plants in the farm and goes to industry should not be consumed. But if it grows on the farm and comes to your table directly, and that's what you should be consuming. Anytime it is getting processed, that's a problem. And if it does not grow on a plant, not the solution. So exposure to rich soil, I talked about that. Soil contributes to human gut microbiome. We know there's data, those who go out in nature and are in constant touch with nature, they're less likely to have Crohn's disease. And if they do have Crohn's disease, less likely to have exacerbations. Essential in the evolution of human gut microbiome, major inoculant and provider of beneficial gut microorganisms, helps improve diversity of our microbiome. Synthesis of B12 improves immune system, decreases the risk of IBD. And there are other factors: exercise, detoxification, restorative sleep, stress management, social connection, volunteering. And everything has much more science behind it. But the major part is food. And today, because we cannot cover everything in one lecture, this is years of learning. The first point is start fixing the diet. One of the things about diet, how many different types of plants should you consume every week? And plants means fruits, vegetables, beans, whole grains, nuts, seeds, herbs, spices per week. What do you think? What's the number? Huh? 100. A little too much. No, not 100. 30. So 30. Diversity is the key. You should have diversity in your diet. Different types of plants will give you different types of bacteria. Diversity is the key, remember. And that will lead to by the way, do you know even apples or every fruit or every vegetable has its own microbiome? So every time you consume an apple, you're getting 100 million bacteria as probiotic. Different kinds of apple from different terrains, different kinds of fruits, different kinds of vegetables. Raw vegetables, of course, if you cook them at high temperature, you're killing those bacteria. It's not a probiotic anymore. So healthy gut microbiome, poor diet and lifestyle leads to unhealthy gut microbiome. Whole foods, plant-based diet, and healthy lifestyle leads to healthy gut microbiome. Hot off the press. How many of you heard of this? Perfect. All right. So effects of intensive lifestyle changes on the progression of mild cognitive impairment or early dementia due to Alzheimer's disease. This is a randomized controlled trial by Dr. Dean Ornish in California. Dean Ornish has done tremendous research for the last 3 to 4 decades, groundbreaking research every single time. And this was published this year. People are spending a ton of money on figuring out medicine for Alzheimer's disease. But just this can give you such amazing results. So what were the interventions? Whole foods, minimally processed, plant-based vegan diet. Should be high in complex carbohydrates and low in harmful fats, sweeteners, refined carbohydrates. And of course, exercise, stress management, group support, and some supplements. Look at the results. Clinical dementia rating, global score, those who did not do the diet and lifestyle intervention, within 20 weeks, their score got worse. Versus those who did the diet and lifestyle modification, it didn't just stop progression, but it improved. That's path-breaking, groundbreaking. Human gut microbiome plays a crucial role in autoimmune disease and overall health. Most common nutrient deficiency, fiber. For healthy gut microbiome, prevention and treatment of autoimmune diseases must consume more than 40 grams per day from whole foods, plant-based diet, not from supplements. All right, like I'll just stop. Of course, supplements will help until you actually get to the point that your diet builds up, because you can't just start consuming 40 grams tomorrow. Otherwise, you're going to be complaining about bloating. You'll be like, Dr. Mutha talked about this thing. I'm worse off now. So low and slow, okay? Build it up slowly. All right. Avoid all animal products and processed foods. Go outdoors. Exposure to soil to replenish your microbiome.